What if my bladder biopsy shows cancer? Discovering that your bladder biopsy shows cancer can feel overwhelming, but understanding what this means is the first step toward managing your health. When your doctor performs a biopsy during a cystoscopy, they remove a small tissue sample from your bladder to check for abnormal cells. This tissue is then examined under a microscope by a pathologist, who looks for signs of cancer and provides details about the type, grade, and how deeply it has invaded the bladder wall. These details are essential because they help determine the stage of the cancer and guide your treatment options. Bladder cancer is classified mainly into two types based on how far it has grown. Non-muscle invasive bladder cancer, also called superficial bladder cancer, has not reached the muscle layer of the bladder wall. It is usually confined to the inner layers and tends to grow more slowly. Muscle-invasive bladder cancer has penetrated into or beyond the muscle layer, which can make it more aggressive and more likely to spread to other parts of the body. The grade of the cancer also matters. Low-grade cancers look more like normal cells and tend to grow slowly, while high-grade cancers appear more abnormal and are more likely to grow quickly and spread. Once cancer is confirmed from your biopsy, your healthcare team will likely recommend additional tests to see if the cancer has spread beyond the bladder. These tests can include imaging scans such as computed tomography scans, magnetic resonance imaging, positron emission tomography scans, bone scans, or chest X-rays. This process, called staging, helps your doctors understand how advanced the cancer is and plan the best course of action. Treatment options depend on the cancer's type, grade, and stage, as well as your overall health. For non-muscle invasive bladder cancer, the initial step often involves removing the tumor during the biopsy procedure itself, a process called transurethral resection of the bladder tumor. Additional treatments like immunotherapy or chemotherapy directly into the bladder may be recommended to lower the chance of the cancer returning. For muscle-invasive bladder cancer, more extensive surgery to remove part or all of the bladder might be necessary, along with chemotherapy or radiation therapy. Sometimes, targeted therapies or immunotherapies are options as well. Living with a bladder cancer diagnosis can be challenging, but many people successfully manage their condition, especially if caught early. Regular follow-up is crucial because bladder cancer can recur even after treatment. Your healthcare team will likely schedule routine cystoscopies and imaging tests to monitor your bladder health. Maintaining open communication with your medical providers, asking questions, and seeking support from loved ones or support groups can make this journey easier. Remember, every case is unique, and treatment plans are tailored to each individual. Always consult your healthcare team for personalized advice and guidance. Staying informed about your condition and following your doctor's recommendations can help you navigate this diagnosis with confidence. This information is based on current medical guidelines and research, and your healthcare provider is the best resource for understanding your specific situation.